You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. I am super excited today to be joined by Dr. Teresa Brockie. Dr. Brockie is an indigenous nurse scientist and educator whose culturally safe research focuses on achieving health equity through community-based prevention and intervention of suicide, trauma, and adverse childhood experiences among vulnerable populations using cultural interventions. She is an assistant professor at Johns Hopkins School of Nursing with a joint appointment in the Johns Hopkins Bloomberg Center for Indigenous Health. She is Ani from Fort Belknap Reservation, Montana. Dr. Brockie earned her PhD at the Johns Hopkins School of Nursing and completed a postdoctoral fellowships with the National Institute of Health Clinical Center. She is principal investigator or co-investigator on 11 projects, including 2 R01s and 2 randomized control trials. Dr. Brockie is a fellow in the American Academy of Nursing, currently serving as a member of the Diversity and Inclusion Committee. In 2020, she received the Brilliant New Investigator Award from the Council for the Advancement of Nursing Science, American Academy of Nursing, and received the Rear Admiral Faye G. Abdullah Award for Nursing Research from the United States Public Health Service in 2016. Welcome to the show, Dr. Brockie.
Thank you.
We'll start with my regular questions for all my guests is, how did you decide to get into the profession of nursing?
So when I was growing up on the Fort Belknap Reservation, I witnessed the great work public health nurses were doing in our community. Not only engaging our community, but advocating for our people and improving health outcomes. However, it wasn't until when my grandmother was dying from cancer and was provided care in her home that I intimately observed the care and love provided by our tribal public health nurses. I was inspired then by them to give back to my community by becoming a public health nurse.
Fantastic. What was your process in when you first decided to, you said you're going to go into the field of nursing. How was nursing school for you?
It was a challenge, and I understand. I understand the challenge now. Looking back from where I currently stand, none of the nursing content included anything about Indigenous people. There were no Indigenous faculty. There were a lot of other students in my program. I was part of the RAIN program at the University of North Dakota. So that is the recruitment and retention of American Indian nurses. Housed at the University of North Dakota. They've supported and graduated a lot of Native nurses in that area. So there was a lot of other students, but very limited. I don't think we even had any nursing faculty who were Native there.
How did that impact your learning? Because one of the reasons I do this podcast is making sure that the diversity I bring to the podcast is purposeful, because I want to make sure that people see nurse scientists, nurse leaders, or what have you, of different backgrounds and cultures, because we don't always get to see those in the textbooks that we read, or the people that we always engage with. So how do you think that impacted you not necessarily seeing someone that you could on a faculty level where you can either model after or see as a role model.
Um, I think by then I was not comfortable, but accustomed to the exclusion of Native people in all aspects of research, right? So you get American history that is void of anything closely related to the history of Native people in this country. So you learn how to debate at a young age your truth
Hmm.
and the book's truth. And often, teachers who assign your grade, you're debating these with. So by then, I had lived a life of primarily of one of exclusion of Native people at all aspects of this country.
Wow. Now, on the other side, you mentioned that there were other students in the class that were native. How did that impact you, or what difference do you think that made for you?
It inspired me, just as the native nurses working in my community inspired me. Their success inspired me. I had also become aware of other nurses, although not at that university, at other universities, who were faculty, who were researchers. So from afar you admire them, and you want to be them, and you look up to them. So that was kind of how it was, and those are the things that motivate you to finish your degree or to complete your degree in nursing.
Well, I'm certainly happy that you finished your degree, and I'm here and speaking to you now. How was your experience once you finished the program? How was going back? Did you go straight into public health nursing, or did you do
I
something else?
did, and I grew up, as I said, on the Fort Valnut Reservation, and being served primarily by healthcare by the Indian Health Service. And I remember it was kind of ingrained in my mind what my grandmother used to say, and that was that we get healthcare providers that come here to practice on us, and they learn their skill by practicing on us, and then they leave, so that there's no consistency in care, but almost for the most part seen as guinea pigs, right?
Wow.
For people who want to come and practice. So I had it in my mind that I was not going to go and, go home and practice on my people. So I went to California and practiced on others. Um, I chose to, well, I got a job at the San Diego American Indian Health Center, which is how I ended up in California.
Not being familiar with the Indian health system, how is that experience, do you think, different than somebody that's graduating a nursing program and going into and working in urban settings that are just serving the general population?
Um, from a nursing perspective, or what?
Yeah. From the nursing perspective, like as far as just knowing a little bit of a background on how some of the Indian health systems work, and I'm a little bit familiar with what the Alaska system kind of looks like, and sometimes they're under resourced. So how do you think the experiences of you working in that setting versus like one of the big hospital settings would be different?
Let's see. So the Indian Health Service is the government agency that is charged with providing care to eligible Native Americans, and that includes 574 federally recognized tribes, about 2.5 million Native Americans. It is funded at 60%
Oh, wow.
Of what is needed. And the nurse vacancy rate are very high compared to the U.S. average vacancy rates. The RN vacancy rate is like about 23% vacancy rate in Indian Health Service, so among the 12 geographical areas. And it is in the more remote regions, it is 40%. The overall nurse vacancy rate in the US is about 7.5 or 7.5%. So significant difference. And even if you look at if you look at nurse practitioners, the vacancy rate there is 36% and as high as 60% in some IHS areas. So depending on where you're going, there's a great need, a significant or tremendous health disparities experienced by some of these communities, especially the rural and remote communities.
Wow, that's, look, hearing these numbers, it's amazing that there's such disparities among the two areas of healthcare. Now, I have a question for you, and I want to get back into your career path in a minute, but while we're here, how would you, what would be your recommendation or suggestion to decrease those numbers, because or to close some of the gaps between what the government provides as far as funding, or and also how do we get more healthcare workers into these areas to close the gap? And do we want to, I'm asking a lot of questions now. Do we want to invest more in the native populations, that we create nurses in the native populations to fill those gaps? Or how do we become, and I hate the word culturally competent, I have to put that out there right now. How do we increase more nurses that are culturally aware and can provide equitable healthcare in these populations?
Well, I don't think it's about culturally competent care. If the vacancy rate is 60%, that means we're not recruiting the right nurses that will go to these communities. And so if the nurse, if we look at the nurses that work in either Indian Health Service, tribal, or urban settings, 60% of them are Native. That means they come from those communities. They're going to stay in those communities that we're going to work. That means that if we want to change that vacancy rate, we have to start recruiting nurses from those communities. Yeah.
And I think that goes
strategic and focused about it, not like general.
Right.
General does not work for us.
Right. And I think that holds true for most communities that tend to be underserved. That when we recruit from those communities, they tend to go back into those communities and serve the population.
I'd like to see that report.
Yeah. Well, I mean, yeah, but just looking at, for example, up until this past summer, I was an educator or faculty at a university that primarily served the LA basin. And the communities that we served, like just around the university, tend to be an underserved Hispanic population, where most of our graduates stay in the community and are in those hospitals and in those community settings. So, I mean, that's just my own personal example, but I think that would be that's something, hopefully somebody's doing some work, or somebody hears this and gets a light bulb over their head, to invest more specifically and strategically, that we're recruiting from the communities, educating and putting back into the communities with investment, right? So we can do that. Okay, thank you. Back to your career. Obviously, you didn't stop at your bachelor's degree. How did you decide you were going to go on and further your education? What was your motivation around that?
I believe someone in my undergrad program planted a seed, as they say, um, that I should further my education. So it was there, but I took maybe one or two introductory nursing, I mean not nursing, but research courses. And I was not really liking research. Um, so at that point, right, it's a beginning, it's not even a beginning, it's just an introduction.
Right.
Um, so um, so it was there. The thought was for me to advance my education. Was there. Um, like I said, I went after I graduated from the University of North Dakota. I first went to San Diego, California, and got a job there at the Urban Indian Health Clinic there, as a public health nurse, working in this. I mean, I came from Hayes, Montana. There's like probably less than 500 people there to this huge, San Diego County is where I was working. So that was a big difference. But Native people are Native people, and so I did what I knew and started developing programs and working with people in the way that I saw, in the way that we do. And so that was a great learning experience. And then from there, I went to San Jose, which is in Northern California, and worked at the San Jose American Indian Health Center as the community health services director and slash public health nurse. And then it was there that my skills were being honed and developing programs, and I was really excited about the work that I was doing. And I will say that some of the programs that we created when I was there are still running. So I'm happy about that. But it was also a time where I thought, oh, if I had this, then I could be more efficient at my job, or this skill or that skill. So I thought, well, this would be a good time for me to go and get a master's degree, and then I'll come back to California and continue working and doing my job. So I looked for dual degree programs, MSN and PhD programs. I ended up coming to Hopkins for their master's in nursing, with a focus on public community or public health. So it was a 17, at the time, 18-month, 24-month program. It was very short. I drove my truck out here, and I had my music, my books, and my, what I needed to get through my master's degree. And I thought, well, in a short while, I'll be back out into California. And that was in 2003. Halfway through my master's program, I came to the understanding that if I wanted to have an impact on the health and healthcare of Native people, then it is best done through data, through research.
Right.
So at that point, I said, well, I'll just get a PhD. And it was a little naive for me because I didn't know anybody personally in my family who had a PhD, but thinking that it was, I'll do this. So I went from my master's degree right into a PhD program.
Wow, amazing. Um, Yeah, and I think that that's one of the that I think that's a commonality that I hear quite a bit from the people I speak to on the show is the PhD program really comes as a result of impact, right? Like how can I have bigger impact in the work that I'm doing? And the PhD or the doctoral programs tend to open more doors for us and give us a different skill set that helps us get around. Myself being prime example is I had just finished or I was in the process of finishing my own dissertation work in my PhD program where a big university reached out to me and said, hey, can you do this paper on this topic that we're looking for? And they just happened to have known what I was working on through a colleague of mine. So yeah, that impact really is why a lot of people go into the doctoral programs or PhD programs more specifically. So thank you. I want to talk a little bit about your not a lot, not a little, but a lot about the work that you're doing. I mean, you're on there's 11 different projects and work doing a lot of work around research. That's been your what you kind of went into the field for. Um, can you share with us what kind of work you have done and what where you see yourself moving forward as your career progresses?
So I did my dissertation study on the Fort Peck, a reservation in Montana with the Assiniboine and Sioux tribes, or the Nakota and Dakota tribes. Um, in 2010, the tribe experienced a suicide cluster. Um, and the tribal leadership declared a state of emergency related to suicide in July of 2010. And I conducted my dissertation research in 2011, so very close to a suicide cluster. But my dissertation study, looked at the risk and protective factors for youth suicide. So we surveyed 288 youth, 15 to 24 years of age. That the findings of that study were used to develop an intergenerational intervention to address stress and trauma with parents and improve outcomes for their 3 to 5-year-old children. So it's focused on both historical and contemporary traumas. We're currently recruiting. It's a randomized control trial. We're currently recruiting participants for that study.
Amazing work and very much needed. How much do you think of being native yourself impacts the studies that you do? Because there aren't that many Native American scientists, especially nurse scientists, that are doing this kind of work. How much do you think you having that background brings to the table or makes the study different than somebody else doing the study?
I think my world is based upon my lived experience, and my research questions will certainly be different from someone else who had a different background. So I think that it in that way it influences my research questions.
So from a diversity perspective, right? Um, because we are in a profession that is dominantly white and female.
Mhm.
How do you think having a diverse population of scientists, or how will a more diverse population of scientists impact research overall? And if you think that impact is important, how do we diversify the population of nurse scientists?
Well, I think that uh, it's common to see it in research papers and here among colleagues. Um, it's a hard to reach community. It's hard to reach. When we use that language, that means we're not going to do the work because we make that assumption. It's an assumption because we don't know.
Right.
Uh, so I think that one, we should take steps to diversify to meet needs of populations that we're not having an impact on or health disparities, but also for research, right?
Right.
How many of my colleagues have here at the university have engaged in Native American work with Native Americans? Before me or after me.
Right.
So if you're not going to do the work, you should at least recruit people who will do the work.
So, from a perspective, and this is coming actually from a personal interest, where my work is primarily with the veterans population, and I know there's a little bit of data on, even though our Native Americans have served in almost every uh, you know war that we can think of, or they have served in every war we can think of. How do we engage with different populations? What do you think would be the first step for somebody that is looking to engage with a native population, but may not necessarily feel that they have the cultural understanding or the cultural awareness of what they need to do?
I think they can partner, or they can collaborate with other researchers.
Yeah.
Or with Native communities. I think Native communities would welcome that.
That would be great. From a again, coming from somebody who is again interested in a population, are there resources for somebody like, for example, again, me, looking to engage in with the population? Are there resources for me to look at or educate myself on, before jumping into a research study, just because somebody may think, oh, here's something that hasn't been studied, and instead of just jumping straight into it, should they be, I'm a qualitative researcher. I really believe in the engagement and partnering with a community that I'm studying. Is there opportunity? But I hate going into those conversations naive about everything. I like to know. So are there opportunities, or what opportunities should I take advantage of if I'm looking to engage with a community of people?
I think there's a lot of published literature on engaging with Native communities, about what to do, about what not to do. I think that would be a good start. And as researchers, that's kind of where we start. We look
Yeah.
into literature to see what's out there and what's available. There are a couple of organizations where I would start. Indian Health Service, there's plenty of data there. National Congress of American Indian, and then there's another one, National Indian Health Board. Those are national organizations that I would look at. And then at universities, there are some universities that have a large like cohort of or a centers for American Indian Health, Johns Hopkins being one of them, Center for Indigenous Health. There's one at the University of Colorado. So there are particular universities that have these centers. I would look at their websites too, reach out to them. So yeah, it's I
And
mean,
I think part of what maybe the hesitation of some people would be, and why some people would be calling it like difficult, or it's difficult to engage,
mhm.
is just like any other culture that we're not familiar with, right? I think it comes from a place of not knowing the do's and don'ts, right? We don't want to, we don't want to. I guess we make ourselves vulnerable by engaging with a community we don't necessarily know. So I think what you recommended of engaging with some of those organizations ahead of time may alleviate some of that knowledge gap that we sometimes feel. Thank you. Now, if you had one more question for you, if you had your way of if you had the opportunity to create your own research cohort and create your own organization of nurse researchers looking at the Native American population, what would something like that look like for you?
I would,
Who
it,
would you want on your team, so to say?
it would require probably at least several more nurses at my level, so at the PhD level, and then some in the pipeline, right? Maybe statistician, epidemiologist, um, and some funding. Certainly funding that would, non-competitive funding that would allow a lot of creativity, some for research, but also some for training. And we can't do the work without having people in the pathway to replace us, but also to contribute to the work. And I say that not to say that we're there, but that's where we're going, right? We have a pathway to nursing, public health, and STEM for Ani and Nakota high school students. So starting at an earlier age, influencing them, and then we have a training program for undergrad students. And then we have our team at Fort Peck and Fort Belknap that we've won in a PhD, currently in a PhD program, and hopefully one in a master's program here at Hopkins. And so we just have to, as they say in our native communities, grow our own.
Right, right. Now you mentioned something that I was going to ask you: funding. How is funding for studies in the native populations? Because I know some things get more attention than others, and this is an area that I'm not in right now. But how is funding since you are doing this kind of work?
Right. So let me answer that question after I back up a little bit, because you had asked me about my research,
Yeah,
and I talked a bit about Fort Peck.
yeah,
Um, so we're on a path of developing research projects in that community and implementing them, testing, evaluating interventions. In 2019, my own community experienced a suicide cluster.
oh well,
And I lost my nephew during that cluster, and I
sorry.
lost some close relatives as well. And so we turned our focus a bit to Fort Belknap. We established a relationship with the tribal leaders, and we started applying for funding. Our first, and we've taken a multi-level approach for addressing suicide at Fort Belknap. Our first funding came from the WT Grant Foundation. When we were awarded that, we found out that half of the funding would come from the Doris Duke Foundation. So they're funding our suicide study. And then we, along with the tribe, received Native American Research Centers for Health grant from the NIH. That's funding our pathway to nursing, public health, and STEM for Aani and Lakota high school students. It's also funding our adaptation of a mental health certificate program for nurses that work in Native communities, and the training of nurse leaders and tribal leaders in public health. And then we also received additional funding from the NIH for our summer pathways program as well. So there is funding, as we found out, available. I can't measure it, whether it's a lot, whether it's little. I mean, we can always use more, just because there's so few Native people there's so few people doing the research in Native communities to address health disparities, to address these issues, but there are even few Native people who are doing it. So we need a lot of help. Any way we can get that. Yeah, but funding is really, plus in addition, I'm housed here in Baltimore. Our work is out in Montana, so we're going out there a lot for meetings to do the work. So now back to your question.
Yeah, so I mean, really the funding question, because but from what you mentioned, it's really two possible issues. Funding, you could always use more, which is always, and I think every researcher would like more funding, but also the research is not. We don't have enough people researching the community, so that's another component of it. How important is it for people to, and I know, just answer for myself. I mean, it's important, but how sometimes we see research being done without necessarily partnership with the community. How important is it to make sure that you are partnering with the community in the Native populations when you're doing research?
For the most part, there's a big distrust of research in Native communities. And it's not firsthand experiences they've heard, but it's because of harms done in research in the past.
Historic.
Yeah, and the harms done, it's not too historic though. It's not
right.
like it's 100 years ago. It's like 10 years ago.
Yeah.
So
okay.
So there's that, but it's been carried out primarily by non-Indigenous researchers. However, the distrust is research, and whoever's associated with that, whether you're non-Indigenous or Indigenous.
Right.
So I'm paying for the harms done, by other researchers. So that means that I have to move cautiously. I have to be respectful. I have to, make sure that I'm ensuring that the safety of I'm conducting culturally safe research in these settings.
Yeah, and that's one of the things actually when I read your bio when you first sent it to me, is that culturally safe research, which is a term I haven't seen before, which I love, by the way. But that is really, and I just had a conversation with a colleague about IRBs, and how some people view IRBs as the sort of like this bad thing that just keeps researchers from doing research, but it's really the safety, right? Is that safe? How do you create that safe environment for the people that we are researching, and making sure that we're really not doing harm?
Well, IRBs in general are the harms done by research the harms done through research in Native communities, those studies had IRB approval, right?
Right.
So if you don't have someone from that community who has that particular perspective, who
Right.
can ask those critical questions, the approval is almost, it allows harms to happen.
So it's also the and you're I'm agreeing with you on this, but also making sure. So yeah, so that safety is not only from the researcher perspective, but how are there's representations on those IRBs that are approving the research on top of that, plus partnerships and building trust. So that building trust with I think most populations that have historical harm, I think there needs to be a set amount of time dedicated for that trust building, for that research to be successful. Would you say that's something that as researchers, everybody should just put in that time? Because it's not like a clinical, necessarily some kind of clinical research where you're just looking at data or blood work and things like that, but actually engaging with communities. How do you build that trust? Is that what I'm hearing from you?
Yeah, I think you have to take time to build the trust, so for us, so building trust is important. There's ways that you can, there's specific things that you can do to build that trust. But being respectful is goes a long ways as well. So
Right.
if you're conducting research in a tribal jurisdiction, your study should be authorized by the tribe. And so for us, we go to tribal leadership and we tell them what we're going to do and we ask their approval. So they authorize our work through tribal resolution. And then we go to the university IRB, and then we go to the tribal IRB. So a lot of tribes have established their own institutional review boards
Wow.
related to those harms done.
Right. Right.
And so it's not only, so it takes us a long time to get through those approvals. Within our tribal resolution, though, the kind of the rules of the work, or the guidelines of the work, are established, and the tribal resolution is tribal law. So it starts with the project. Here's what we have to do for publications. Secondary use of the data requires further tribal approval. And the protection of indigenous knowledge is in there as
Right.
well. So all of that is included in our tribal resolutions. And then we go through the process of getting IRB approval through the tribe for our research, also through for our publications and our presentations. And it's all to protect participants,
Right.
Native, Indigenous, or Native research participants.
Right. Well, great. Thank you. I appreciate that. I learned a lot. Um, Now, I want to be cognizant of your time. Anything else you want to share with our audience?
So I'll go back to that. No, I'll go back to one thing: cultural safety in research. So cultural safety is a philosophical and conceptual approach that considers how social, political, economic, and historical contexts shape experiences and health outcomes. So our health outcomes. Research suggests that over 1 in 5 Native Americans experience discrimination in clinical settings. This finding highlights the importance of cultural safe healthcare and training pathways for Native American scholars, but also nurses as well. So improving cultural safety in research is research that aims to understand, respect, and acknowledge tribal sovereignty, address historical trauma, and endorse indigenous methods. Some of that is essential, culturally appropriate, community based and engaged research collaborations with Native American communities and tribes can signal like some reparative efforts, reestablish trust. And some of that we've been talking about.
Yeah.
The distrust and form pragmatic solutions to longstanding health disparities. Rigorous research led by Native American scholars is critical to address common and complex health challenges faced by Native American communities.
Great. Thank you. As you were mentioning this, one last question for you. What can nursing do better in serving the Native American population?
I think that we were all in awe and disbelief at what COVID-19 uncovered. So 30% without electricity, 40% without running water on the Navajo Nation. We have to go beyond, being in awe, being, oh, how can this happen? How does this happen? And then we just step over it and continue on. We have to be moved to action because it's going to take action. There's too many blatant disparities that have remained unchanged for over 40 years because of our inaction. So if we want change, and we have to want it from top to bottom, otherwise we're just stepping over it. We're stepping around it or over it.
Agree. Well, thank you. I appreciate your time. I know you're busy. So again, thank you for squeezing me into your schedule. We have been listening to Dr. Teresa Brockie. And I hope you enjoyed this conversation as much as I did. And I look forward to bringing you more incredible nurses on future podcasts. Thank you very much for joining us. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.